So what is on your mind today?
So what do you think of the Utah Cares plan that has been unveiled today, 446?
Well, I'm pleased that they've brought forth a proposal. I think that's good news. I think that's a step in the right direction. I guess if I had my wishes, I wish it had been out, 3 or 4 weeks earlier than the last 8 days of the session. But I think that's a good thing to have them have a proposal on the table. And at least I hear that they're going to have a vetting of that and maybe a vetting of Healthy Utah in a committee. And I think letting the public come in and discuss both of those proposals is a good thing.
What do you make of the change of heart from Speaker Hughes adamantly saying there's no need to bring it up to now has been assigned to the committee?
I have a high regard for Speaker Hughes. I think he's a good man, and he's new in this role, and there's probably a learning curve for all of us as we step into new assignments. And I think he's realized that it's important for the public to have an opportunity to voice their concerns, to hear the pros and the cons of these issues, and particularly of an issue of this magnitude. And I expect that he's just realized that, and his leadership team has said, hey, let's go ahead and let the public weigh in on it and vote and let the chips fall where they may. So I think just a kind of an awareness that's happened over time.
Did you have a role in that awareness, Governor?
Not really. I know the public has weighed in a significant way, and so I think that he's responding to the public, which is what we should be doing in a representative form of government. And so I think he's hearing the cries out there of, say, let us weigh in on it. Again, I'm smart enough to know that not everybody is pro-Healthy Utah. They ought to be, because it's certainly the best plan out there. But there are people that want to weigh in and say why they support it, but others want to weigh in and say why it's not something they would like to see supported. So again, it's part of the process. And as I've said before, process counts. It's important that we vet things openly and transparently and let the people we represent come in and give us their feelings and listen and learn from the comments, ask the tough questions, get answers, and then make a decision.
You've been working with the feds a lot on Healthy Utah. From what you know of this new bill that's just come out, will the feds accept it?
Well, I don't know that the feds have to accept a lot. The biggest difference is that with the program, as I understand it, and I haven't really had a chance to see all the bill, but I know some of the particulars, is that they're going to stay with the 70-30 match. When we talk in terms of the cost to the taxpayer, and let's compare apples with apples, that's what we need to do, and I don't think that always that is the way it comes out in the press, so you can help me out here. For 2 years, the pilot program for Healthy Utah cost $25.4 million. That's the total cost of the taxpayers. We'll draw back to Utah taxpayer money of about $960 million. So just under $1 billion comes back to be put into the marketplace for use here in our economy and to help with insurance acquisition and those kinds of things. It helps about 126,000 people overall. So a lot more people get served in that process. The alternative that we hear from the House is going to cost $77.2 million, is the estimates we have out of the Department of Health and the Office of Management and Budget. So significantly more expensive over the 2-year pilot of both programs, and serves about half as many people with lower, less robust health care coverage. At the same time, it draws back about $60 or $70 million. I probably actually have that here if I want to look it up. $195 million compared to $945 million, the actual number. So Healthy Utah, $945 million comes back. House plan brings back $195 million. Healthy Utah enrollment is 126,500 people. The House plan is 57,000 people. Overall cost of Healthy Utah is $25.4 million for the 2 years. For the House plan, $77.2 million. So the actual cost, there's some sheets if you want to look that up. Again, I think the benefit that I really like about the Healthy Utah plan is that it's not only addressing the health care needs, but it should not be overlooked that we enroll people into a work program. When you sign up for Healthy Utah, you automatically enroll into a work program which helps people to get off government assistance, to get a better job if you're able-bodied, to get a job if you're unemployed. And I think that's part of the Utah culture that I think fits very well. At the end of the day, you know, as I look at all the programs out there, you know, I obviously am a staunch supporter of Healthy Utah 2.0. We've modified, we've improved, we've listened to the concerns, we've made adjustments, and I think it is the best plan for the taxpayers. It certainly is the best plan for those people who are trying to help, those who are most vulnerable amongst us in our society, the working poor, and I think it's the best alternative to Medicaid expansion. I think it actually gives you better outcomes, better choices for the consumer, more health care choices, and just on many levels, I think it gives us a better health care outcome, which is the end result of all of this effort. So,
would you accept this new bill then, if it's so clear?
you know, I want to hear the debate, and I'll certainly listen with an open mind to hear their arguments, whatever they may be, pro and or con. Just like I'd expect them to hear the arguments pro and con on Healthy Utah. But I'm here to tell you, as you analyze the costs and the benefits to those costs for the Utah taxpayer and for the people of Utah, Healthy Utah is, in my mind, absolutely the best plan.
I think what we keep hearing from them is that the sustainability factor, and they believe this plan could be more sustainable down the future.
Well, sustainability certainly is a legitimate issue, and how you sustain it is either keep costs in check or provide a revenue stream that will grow and expand with the demands and the costs that they rise. That's what we've done with Medicaid, particularly with the rise of healthcare costs. The program Medicaid isn't a bad program. It's just that somehow along the way we've lost control of healthcare and its rising costs. And so it impacts any healthcare program. Insurance premiums that have gone up, Medicaid costs have gone up, all because we've not been able to address the underlying issue of rising costs of healthcare. So that's an issue we ought to address, and frankly, something I'm going to bring up with the National Governors Association is let's focus on that issue, not just the delivery system or how we pay for it, but what we do to, in fact, stem the rising costs of health care. That's, I think, an issue that needs to be addressed, not only with the states, but with the Congress.
Does the greater Utah and southern Idaho area offer a unique marketplace as far as the provider side in your view?
Well, Utah is unique in this issue because, one, we already have the lowest cost health care in America here in Utah. We have probably the fifth rated best quality of health care in all of America. So low cost and high quality, that combination puts us right at the top of the list when it comes to where you want to be to get your health care. We have a healthy lifestyle. We have a culture that's, lends itself to a healthy lifestyle. We also have a culture of work, of really not applying to the government for a government handout. This work requirement that we talk about, the ability to help people, not with their health care needs, but with their workfare needs, is an important concession that we've got from the Obama administration. And so, again, I don't want to belabor the point, but anybody who signs up for Healthy Utah automatically enrolls into a work program to help them be analyzed to see where they're deficient in maybe their skills, their education, their training, and let's see if we can help them so they can go out and get a better job or get a job. And that's pretty well kind of the Utah approach to things. And so I think we have a really good chance of addressing this issue going long term. It's a 2-year pilot program. We have the opportunity to do data collection. We'll see how it works. We'll see how many people enroll and what the actual results are. As you all know here, with any proposal out there, there's a lot of speculation. Well, if we do this, then that's going to happen. If we do that, then this is going to happen. And the truth is, it's a lot of speculation. We don't really know. We have some ideas, and so the 2-year pilot program idea is a good thing. The long-term sustainability, though, too, is in what we're talking about with grandfathering people in, like we did with our pension program. This is an idea that the Senate is talking about, where we could say to people, if you're on the program, that we won't pull you off. If you have insurance now, just like you were on the original pension program, it was not sustainable, same kind of issue and concept, that will grandfather you in. But those who come in on the second tier will come in on a different program. We'll be able to ascertain that as we just do this study over the next 2 years as far as what we need to do. We can have sustainability, and we can be sensitive to people and not jerk the rug out from underneath them on this kind of a grandfathered program, I believe. And we can get those waivers, I think, with the Department of Health. We've already talked to Secretary Burwell about this idea. And so I think those issues can be addressed. That's why I like the fact they've got a program out there. Hopefully it'll open up discussion again. And we can find, the right place to be. And for me, that's Healthy Utah 2.0.
What about the idea
compromise?
of marrying the two together?
Yeah,
Using Healthy Utah as
It's a good compromise question.
the. Yeah.
we married the two
I'll
questions.
start.
Well, I see the compromise here between the Tribune and the Deseret News. Yeah, if you guys can get along. I'm intrigued by the idea. And so, I'm still supportive of Healthy Utah 2.0, but I'm intrigued by the idea, and I expect there'll maybe be some discussions on that. I've heard other people say, no way, no how, it's not going to happen. So I'm not going to get too excited about that, but it certainly is an intriguing idea.
The House has suggested rather than start with Healthy Utah and go to Utah Cares, which is the way the compromise has been discussed, that you do just the reverse. You start small with Utah Cares and then build up to Healthy Utah if the numbers sustain that.
I think it's legitimate to say, let's start small and build up. I understand the appeal of that kind of an approach. Unfortunately, with this unique situation, we start small and a lot of people go without. And so we ought to see what we can do to help people immediately with our own money. It's our own dollars that we are sending back to Washington, D.C., and as I've said many times before, the expansion starting, large has already occurred. We're being taxed for it. The expansion is voluntary to take the money and use it, but the taxes are mandatory. We're having to pay for it. So our choice really is to pay for it and not use it, or pay for it and use it. I think it's common sense. I think, in fact, it's conservative common sense to not waste taxpayers' dollars. We've tried to manage this state as efficiently as we can. We've been recognized as the best managed state in America, and that's because we don't waste taxpayers' dollars. We make sure that we take them and use them as effectively and efficiently as possible. That would say to me that if we're spending money out there, we bring it back and spend it more effectively than leaving it in Washington, D.C. to spend it in other places and other states. My rule of thumb has been, and I think something that really reflects the people of Utah, is please, federal government, don't take the money from us in the first place. You don't need to develop any new programs to make us happy. We're doing quite fine. So don't take the money from us in the first place. If there's an idea out there that we want to replicate, we'll do it internally within the state of Utah with our own resources, working with our own taxpayers. But if you do take the money from us, then give it back. And as close to a block grant as you can, so there's not any strings attached, is what I would like to see happen. And whether that's on transportation funding, whether it's on education funding, whether that's on health and human services, Medicaid, block grant the money back to us, because we can spend it more effectively and more efficiently than you will in Washington, D.C. We can prove that. And so that's the principles. First, don't take the money from us. If you do, give it back in as close to a block grant form as you can. And that's why the common sense conservative approach to this is the Healthy Utah, which takes back our money and spends it in a much more effective manner.
Governor, the House has moved on, or the House and the Senate have moved on the issue of letting the Prison Relocation Commission make the final choice of a new site. Have you moved on the idea of keeping Draper in the mix, building the prison on the Draper side of the mix? You suggested recently there's a 50-50 chance it could stay there, a better site, and it might not be found. Do you think now that it will ultimately move?
Well, let me just go back to my original position from the very beginning of this. We have a prison out at Draper. It needs to be remodeled, fixed, improved, rebuilt, all of the above. It's going to cost a lot of money to do it. So the question is, do we do it there or do we do it someplace else? If there's a better place than Draper, then we ought to move it. If there's not a better place than Draper, then it ought to stay there. That's what I've always said. Now, don't get hung up on if I say it's 50-50 or 60-40 or 70-30. The responsibility is to us to find a better location. And if we can find one, then I think the move should happen. I clearly don't like the idea of just having a 7-member commission do it, bypassing the legislature and their responsibility to vote this up or down, and in fact cutting out the executive branch. It appears that we're coming together on that issue, and I expect that whatever the recommendations will be from the commission, those who are out looking as the search committee, they'll bring a recommendation back to the full legislature. It'll be debated, it'll be voted up and down, and I'll have the ability to weigh in and sign the bill or veto the bill. So that's the way the process should work. I think there's a lot of reasons why finding a better location it has merit. And, this really is not about just the real estate that can be developed between the two counties. I mean, maybe that's an intended consequence of this, but it really is about building better facilities to provide better programming for the inmates there so they can be rehabilitated. It's not just a matter of warehousing people. That's the old school. We're in a new school here, environment where we're going to try to help people rehabilitate and go back and become productive members of society. Our recidivism rates in Utah are too high. When the average rate is when you leave the door and have the exit out of the prison, you're back, 66% of us, of the prisoners, are back in 3 years. That's too high. We're doing something wrong. So we can improve that. That's part and parcel of the motivation for us having a new prison.
The Senate committee today approved the constitutional carry gun bill that you vetoed in 2013. You had an agreement with Representative Oda, I believe, to kind of back up. He was going to kind of back off on that. Senator Heathens, I guess, was not party to that agreement and went ahead and did it anyway. Do you still have reservations about that? What would you like to see done?
Well, again, I'd like the commitment we had with Representative Oda to be upheld. There was not any great motivation or rationale behind the change of our concealed weapon permit laws last year. The idea that some cowboy's out riding his horse and the storm comes up, he put his poncho on and it covers up his sidearm and somehow he's hassled by a forest ranger, I think is a myth. We've tried to track that down to find if that anecdotal story ever happened. We can't find any credibility to it. Clearly, if that's the issue, we can probably find ways to address that and in a much more responsible manner. I think our laws on the books work very well. I've had communications with the NAR people. They think Utah is a very strong Second Amendment state. They don't have any problems with how we're doing things. I see no change that's happened in the last 12 months when we vetoed the bill before that would cause us not to veto the bill now. There are maybe some issues of discussion, like what do we do with college campuses? When we have people come on college campuses on concealed weapon permits. We have Supreme Court Sotomayor comes here. Nobody carries, the federal boys trump everything. So we ought to maybe have a thoughtful discussion on what should happen if people are willing to engage in that discussion. But I frankly think the laws we have in the books right now are working very well. There's not really any problem out there that needs solving. So why make a change? I don't understand the motivation there.
So if this goes through, would you veto it?
If we have the same bill that comes up this year that we had last year that I vetoed, I certainly would veto it again this year.
Right, so on the issue of non-discrimination, the bill's coming out tomorrow. Have you seen it, and does it have your support?
I have not seen it. It's been worked on, I think, very diligently by people on all sides of the issue. I understand it's been hard lifting and hard work, and people have worked, I think, very well together and trying to find that common ground. I'm anxious to see and hear what they produced, the work product, which will come out tomorrow, as I understand it. And so we'll be looking very anxiously at that and take a look and see if we think it's the right place to be. I know people work very hard, and I compliment all those who've come together to try to come up with this anti-discrimination bill, and I'm cautiously optimistic that it'll help us get to that common ground we need to find.
Just quickly, Governor, Friday, are we going to see any movement on budget for Amanda Smith and the Department of Environmental Quality to relating specifically to the air measures? We've seen some pushback from the legislature on some specific issues, but she said that she just needed some money for FTE to get her job done. And so
Yeah.
we're gonna see some of that on Friday?
Well, the budget's still in a state of flux. It all kind of comes together the last, week, and so it's probably one of the smaller stones. They talk in terms of the big stones: education, transportation, health and human services, the big rocks that go into the bottle. And we need to have money out in the Department of Environmental Quality to have not only enforcement, but to take a look at the regulations out there and monitor what's taking place. So we need some money out there to make sure that we can do our job when it comes to the air quality and other environmental issues, not just air quality, but other ancillary issues like permitting for our drilling out in the basin, how we permit those folks out there, and monitoring that, make sure that everybody's playing by the rules. So there is some need for review and regulation and enforcement. I'm hopeful that they'll put some money into the buses, $20 million, what I propose, to make sure we have better buses. We all know that a big part of our air quality problems and deterioration is because of tailpipe emissions. We keep wanting to hang it on the industry folks out there, which, they're putting hundreds of millions of dollars in best available technology and making significant changes. But we ourselves, as people, need to make some changes. Why? Because we get a lot better bang for less bucks, and we're to the point where you can charge a lot more money and get very little return. But for us, just with some of our own habits, better automobiles, the reason we're pushing so hard on Tier 3 fuels and Tier 3 automobiles is that way we can get a lot better bang, better outcomes, and not have to break the bank to do it. And so clearly, the Department of Environmental Quality needs to have the resources necessary to impose regulations and enforcement and review and working with industry in particular.
Thanks, Herbert.
All right, thank you all.
Thank you,